The second batch of over 2.8 million Pfizer vaccines is set to arrive in South Africa tomorrow, bringing the total donation from the U.S. government to 5.6 million doses. To talk to me about how this will impact South Africa's vaccination drive, I'm joined by South African Medical Association Vice Chairperson, Dr. Mzukwa. Dr. Mzukwa, good evening and thank you for your time tonight on In Focus. Does this mean that any country that seeks to donate to South Africa can now donate, including China with the Sinovac vaccines?
Good evening, Thabo, and to your viewers. Thank you so much for that question. I think really it will also depend on the developments within SAPRA in terms of verifying the safety of that vaccine that comes from whichever country that donates to South Africa. So it's still important that we respect the presence of that agency in our country. But obviously we welcome all the donations, I think, as a country that comes to us, South Africa, so that we ramp up our vaccination program.
What does this mean then, in as far as the fight against the Delta variant in particular, that we will be getting more Pfizer vaccines?
I think it is a good gesture for us because if you look at the moment now, there's evidence that those who are not vaccinated really they complicate, and those that are vaccinated they seem to be coping very well. Looking at the healthcare workers statistics, I think we are doing quite well. But I do think that we need to take good care of other factors as well. You know, the first thing is that we need to make sure that we have enough supply in the country so that we don't delay the vaccination program. But secondly, we need to address the concerns that are coming from the ground regarding the side effects of these vaccines and whether the deaths that are being reported out there are really related or associated with the vaccine. I think we need not just be in a denial mode, but we just have to investigate and also bring that investigation to the public. The minister needs to pronounce on those.
There seems to be this lack of clarity on what it means to be infected when you've already vaccinated and to be infected when you're not vaccinated. Just outline for us what the fundamental difference would be there.
Well, if you are not vaccinated, you can. If you are vaccinated, let's start there. If you are vaccinated, you can still get infected. Remember, the vaccine does not stop the infection, but it stops the severity of that infection, because you remember it boosts your immune system, so you've got a better fighting chance to win the battle of that infection. But if you are not vaccinated, your immune system levels are low or even unable to fight. So you do need to have a vaccine, even if you had an infection before. The advice is that you still need to get a vaccine so that you boost up your levels, because it looks like the vaccine has got a better chance of fighting or boosting your immune system if you get vaccinated as a person. So I think that's where we are. Vaccinated and unvaccinated, you can still get infection, but in this case, if you are vaccinated, you might not get the severity and deaths.
Yeah. Dr. Mzukwa, there are also questions around in a household, if some are vaccinated and some are not, do the ones who are not vaccinated pose harm to those who are vaccinated?
Well, I think it's first of all, we encourage everybody to be vaccinated. I think the most important part around this is if you are not vaccinated, you yourself are putting yourself at risk. But in terms of infecting others, yes, you can still infect those that are around you. Remember, if you infect a person, depending obviously on the age as well, remember, if this person is an elderly person and is vaccinated, you might find that that person has, the immune system is not as a person who's still younger. So if you infect such a person, even if that person is vaccinated, you are still putting that person at a risk. So those people who've got a challenged immune system, who've got systems that are taking their immune systems, to low levels, you might put them in danger.
Yeah. As the association, what are your concerns, particularly around the gaps in the vaccination process and how it's being rolled out? I tell you, it was 2 weeks ago, I think, when I tried to get the jab, and I went to over 3 facilities that at the time I would have thought would have stock, but they didn't, and it was one of those challenging things. Well, luckily on a later date, I did manage to get the vaccines.
Can you come again?
I'm saying, as an association, what are you finding are the challenges as far as the gaps in the rolling out of the process? I was mentioning my own experience of going to 3 facilities that were out of stock at the time, or either they had no staff in place to be able to do the work.
Yes, we do see those challenges on the ground. The most common one is where a person is allocated to a very far vaccination site, and a person will tell you, no, I just can't walk or even take such a long distance, using transport, just for prevention. I mean, if I was going for treatment, then I would consider doing so. But those are the first issues that we face. But the second one is the one that we're mentioning now, where you find that there's not enough staff, but at times there are no vaccines. I think it happened last week, where you find that there's sites where there are shortages. I think that is discouraging, especially to those who are out there willing to get vaccinated, and they might end up not doing this vaccination issue anymore. So it is important that we try by all means, government on their side, to make sure that there's enough supply, there's enough stock, so that people don't get discouraged.
Now, what's your view as an association on incentives for people to get vaccines? It's a lot of talk right now internationally. In the UK, I think they're giving them shopping vouchers, pizzas, free rides on taxis, and so on and so forth. But this is, of course, targeted at the younger audience to get them to get the jabs on. Is this something that South Africa will need to look at, considering our levels of vaccine hesitancy? Are they at that critical stage?
I think, Thabo, we need to look at what are the issues around this hesitancy. It's not just people not willing to go, but it's the issues that they are raising. Issues of side effects, stories that people are dying from the vaccines. I think if we are addressing that, coming out, I mean, we've seen that people are registering in numbers. Even younger people, they are enthusiastic. They are registering numbers. But if you have those concerns that are not being addressed at a government level, to allay the fears, and also to investigate, make it easy to report those adverse effects. Because at the moment, if you report a side effect, you talk to somebody at a call center, and they may send you to a local healthcare center. But you end up not getting the help that you needed as a person. So it's important that we have, clarity in terms of the referral pattern, that when you have an adverse effect, you know where to go. But address the issue that is coming on the ground of side effects, because that's what is the outcry that is out there in the country.
Yeah, indeed. And as far as workplace health and safety, what's the view of the association on employers who are making it mandatory for workers to get vaccinated?
Well, we believe that there is one government in South Africa. We don't know if there are many governments, because the president of the country has made it clear that it won't be compulsory for anybody to take the vaccine. And also the acting minister said the same thing. Everybody from government have been saying the same thing. So you can't have certain government departments saying something different from the message that comes from the central government. I think this administration must have one message for the public, and we can't have fragmentation of the messaging to the public. So this is what they need to rectify. If we go by that, we need to make sure that we clarify that in every sector of society within this country. I understand that we do not have any jurisdiction on the countries outside our borders, but within this country we've been told one thing, that people are not going to be forced to be vaccinated. So I think that let's maintain that message and let government clarify that thing. We can't have the private sector doing their own thing when government says something else and people are hiding behind the law.
Yeah. But from a medical point of view, would companies benefit at all in having some employers vaccinated and others not vaccinated? I mean, does it pose any harm to their operations?
I think it depends, honestly, on the what is being done at that workplace. If, for example, you have a person who's exposed, for example, healthcare workers, it is advisable that they get vaccinated. But also we must understand that there are reasons why people may refuse to be vaccinated. Religious reasons, some may be allergic to the vaccines, you know. How do you prove? If somebody tells you, I'm allergic to a vaccine, do you say, let me take blood and make sure that really let's test that you are allergic? You can't do that. So I think those are the issues that need to be addressed there. But also the issue of discussing health education and promotion, that has taken a back foot when it comes to this country, even in the workplaces, where there is no proper standardized health education and promotion. The issues of vaccines would have been addressed at that level, where people would be allowed to ask questions and be clarified, you know, by whoever is available there in the occupational health clinics. But if you do not have, because you know what is happening in the workplaces, the funding that is supposed to be getting to the occupational health clinics has been taken away. In some instances, you've got a clinic that runs, a doctor comes once a month. I mean, how do you attend to needs of employees? When do you give them an opportunity to ask questions when they have genuine questions? You know, it's not about fear. It's not about these conspiracy theories. People have got genuine concerns that need to be addressed, and they need to be given a platform for that.
That was the Vice Chair of the South African Medical Association, Dr. Mvuyisi Mzuku. I appreciate your time. Thank you very much for joining us tonight on In Focus.